Hi everyone. So my first instances, starting with chapter 7, she was taking anti-eusives to help with her cough. Anti-eusive. They were afraid she might develop lung cancer after finding out she had asbestosis. The tumor on Sarah's lung caused her to have eclatasis. Brock was diagnosed with bronchiectasis when the doctors discovered his bronchi was enlarged when getting infected. Bronchiectasis. When the killer was choking his victims, he was cutting off their oxygen supply, causing them to appear cyanosis. After getting kicked in the face with a soccer ball, Kyle had epistarxis. After running the 5K, it took a while for her to return to eupenia and return to normal breathing. Eupenia. She was having trouble swallowing because of laryngoplegia. He was studying otolaryngology, which is disease of ears, nose, and throat. Easy to remember since the abbreviation is ENT. Otolaryngology. After his heart surgery, he kept experiencing thoracigia. And that was chapter 7. For chapter 8, my first sentence, she took probiotics to help with her bradypepsia. The second sentence, when diagnosed with chronic disease, she lost a lot of weight and was told she had cachexia. They had to take a cholecystograph to make sure the patient's gallbladder was fine. Cholecystograph. After food entered the diverculum, it became inflamed, causing diverticulitis. Many people were suffering from dysentery, and they discovered it was from chemically contaminated water. Dysentery. They needed to virtually examine the esophagus, so they used esophagogastroduodenoscopia. Esophagogastroduodenoscopy. They removed the patient's hemorrhoids with a hemorrhoidectomy procedure. When they discovered she may have gum disease, they had periodontist specialist checked her out. Periodontist. He was having chronic hemorrhoids, so he went to someone who studied proctology. They performed a serum bilirubin test to test for liver disease. Serum bilirubin. In chapter 9, she was prescribed oxybutynin, an antispasmodic, to reduce bladder muscle spasms. Antispasmodic. She was diagnosed with azotemia after finding a lot of nitrous waste in the bloodstream. Azotemia. They instilled a dye into her bladder before performing the x-ray so they could perform the cystography. After not peeing for hours, she had diarrhea. Some kids struggle with potty training and suffer from enuresis. When they found ketones in her urine, they told her it was called ketonuria. Since she had enlarged kidney, they called it neurophilia. Neuromaglia. After drinking 2 gallons of water, she had polyuria. They needed an x-ray of the pelvis, so they did a pylography. He studied disorders of the urinary system, making him an expert in urology. And those are my 30 sentences.